pleasure to introduce Ashok. He doesn't need introduction. He currently is in Singapore. You can see the skyline behind him. He is director of CSI and US. And for us at IBSC, he has been the sort of the founding member and a mentor for a very, very long time. I won't add too many words to his long list of achievements, but he's a cancer specialist par excellence and has worked on identifying mutations and actually identifying small molecular drugs that can help elevate those effects of those mutations. So without much delay, Ashok, over to you. Thank you.
Himanshu, thank you for that kind introduction. Everyone in the audience, it's such a pleasure to be invited to give a few minutes worth of historical perspective, if I may, before your very exciting conclave. Let me share my screen and perhaps say just a few words about the context of the conclave and also a little bit about IBSC. So I think no one in this audience will need persuasion about the first point that I want to make, that is that data science is driving a revolution in healthcare, and like it or not, that revolution is coming. What we already know from multiple different directions is that data science research is transforming our understanding of the causes of human disease, but also contributing to new methods for treatment and even prevention. It's also very rapidly creating new knowledge, new technologies. And so altogether, this promises to really transform healthcare in the very near future. My second point also probably deserves no emphasis in this audience, but I think you will all recognize that data science is not possible without data. And so in healthcare in particular, we need high quality, widely available, multi-parametric, and well-curated data collections, because otherwise it truly is garbage in, garbage out. And although data science in India is very advanced, I believe that the systems that we have for acquiring such high quality, large data collections in the healthcare perspective are not yet as advanced as our data capabilities. And this may be a point that particularly the clinicians and healthcare practitioners in the audience need to bear in mind. Data science cannot work without good data. Why is it that we are on the cusp of this coming revolution? It's my belief that in the near future, we are going to see 4P medicine. 4P medicine is a concept that was first put forward by Lee Hood and his colleagues about 10 years ago. And the idea is that medicine is going to become increasingly personalized, participatory, predictive, and eventually preventive. So a word about each of the 4Ps. I think you're all aware that patients are very different, even with the same disease. And so there has for a long time been a thrust to personalize the care of each patient. This is most evident perhaps in my own domain, in cancer, where the myriad molecular alterations that accompany every case of cancer mean that any given case, even if it is the same type of cancer, will need personalized, individually adapted treatments. Participatory, even in India, we are beginning to see that patients are not customers, but they're partners in the healthcare journey. Their participation is essential for us to collect the data that enables us to make medicine personalized, but also is a necessary part of the way that we move forward with their treatment. And again, my injunction to the healthcare practitioners amongst you is that I believe that India still has some way to go to making healthcare truly participatory and involving patients not just treating them. The last two P's really deserve no introduction or emphasis. Right now, many major diseases like cancer, we treat after they are advanced. That being so, many patients don't survive. Equally, the treatments cause a lot of side effects, are very deleterious to the patients. We need to move away from treating advanced disease towards predicting and preventing disease. And I think this shift is already occurring in cancer. And I'm sure it will also occur in other major diseases, for example, metabolic syndromes, where it's clear that early intervention with diet, exercise, and so on can have a preventive effect from these major diseases. But let's not fool ourselves that this journey towards 4P medicine in healthcare is going to be easy. And I'll illustrate this very briefly, again, from my own domain, where you know that our increasing explosion in the knowledge of the genomes of cancers of different types is fueling the concept that if we understand the genomes, then we can actually drive personalized cancer care. Now, this is all very simple in principle. The idea would be that for any given tumor, as illustrated here, we would sequence DNA from that tumor, RNA from that tumor, and thereby obtain a profile that will then enable us to prescribe the right drug, including experimental drugs, those in clinical trials, etc. However, even in this rather advanced area, there are so many challenges that make this type of personalized care difficult in practice, although simple in concept. I reiterate again, high quality, cost-effective genomic data is not universally available. Data is one thing. How do you interpret it? You need expert practitioners, new AI-based systems to be able to identify parameters and enable clinical grade data interpretation. Remember, these are lives that we're dealing with, patients. Very high quality clinical grade data interpretation is necessary. We need more real-time updates to evidence databases. Things are changing every day, every minute, yet often these databases are months, if not years behind. And of course, there is so much research still to do to expand the basis of evidence that helps us to train algorithms that can interpret clinical grade data. So it's in this context, about 8 to 9 years ago, that I went to IIT Madras. I was at that time still at the University of Cambridge, directing the Medical Research Council Cancer Unit there, and argued to the director and several of the senior faculty at IIT that there was a real opportunity to establish an initiative for biological systems engineering at IITM. I alluded to the fact that there were established strengths in the quantitative sciences and the engineering sciences at IIT, and there was a real opportunity with the importance of healthcare and the progress of healthcare in India to be able to develop an initiative of biological big data. And you can see in these slides my presentation to Bhaskar Ramurthy, who was at IIT at the time, that we were really thinking at that time about quite fundamental research long before its application to healthcare, which was, of course, the ultimate objective. And illustrated here, you will see that at that time, Karthik, Ravi, Raghu, many people in the audience helped me so much through my visiting professorship at IITM to begin to pull people together. It required a lot of convincing. I remember a lot of arguments with many faculty in many departments trying to persuade them that this was important, that this could be done, and this was relevant to both the educational mission as well as the research mission of IITM. But long story short, we were able to kick these off. And look at it now. What a wonderful transformation. This is from the website as of late last night, and you can see that it's a fully fledged center, a center for integrative biology and systems medicine, housed within the RBCDSAI. There's wonderful new funding. There are a number of very important research initiatives that IBSE is participating in, ranging from the Indo-European Consortium on vaccines through to participation in Genome India. Garbini, you're going to hear much more about from Shinjini. I was very pleased to be able to connect Shinjini and Gagandeep in Delhi with Himanshu and Karthik at IIT to make this possible, the initial connection. And of course, there's so much more research going on by Mani, Ravi, and many other faculty at IIT that you'll be familiar with. It would be wrong of me not to say a few words about the journey from then to now. Instrumental in this journey were several people who helped me to transfer some of the ideas and make them practical from Cambridge to India. Vijay, of course, has long been a major champion. At that time, he was at DBT as well as at NCBS. I've known him for many years. And he, along with Professor M.K. Ban, whose presence I still miss, were really instrumental in helping to convince people in India that the time had come for these types of initiatives. Boris, who at that time was the Vice Chancellor of the University of Cambridge and a long-standing friend of India, was also instrumental in enabling me to get time from my appointment at the University of Cambridge to spend time overseas in the visiting appointment that enabled all these activities. In IIT, I think Bhaskar, his support was really instrumental. He believed in this initiative. He supported it unstintingly. And without his wisdom and support, IBSE would never have got off the ground. And I must also mention Rahul Mehta and the Mehta Foundation, who not only funded the Department of Biotechnology at IITM, but also funded the visiting professorship that made a lot of these activities possible. And of course, in IIT, Professor Karna, who was at that time the head of the Department of Biotechnology, Nag, who was at that time in charge of strategic initiatives, lended so much help to make these things possible. So my sincere thanks to them for enabling all the activities that you see today. And I'll really end by saying IBSE is in very capable hands. Himanshu and Karthik have been really active and instrumental in organizing and pushing forward the initiative, making sure that it continues to be productive, raising funding, raising profile, enabling so many of the scientific publications that you see, as well as events which largely focus on the educational capabilities, acquainting quantitative scientists across many domains, including AI, ML, with healthcare, with biological big data, really bringing us and making this, bringing us together and making this conclave possible. So with my thanks to all, let me conclude my brief introduction there. I'm very grateful to be asked to introduce this conclave, and I'm sure you're going to have a great time. Thank you.
Thank you. Thank you, Ashok.